Good afternoon. I'm Marcia Day Childress from the Center for Biomedical Ethics and Humanities here in the School of Medicine. We're delighted to bring you the weekly Medical Center Hour, and today we're delighted to bring you Medical Readers Theater. This is our Wednesday matinee performance of William Carlos Williams' A Face of Stone. 21st century medical education includes a robust program of arts-based learning opportunities. Narrative medicine and visual thinking strategies are two examples of arts-based pedagogy currently used at UVA to improve young clinicians' core humanistic skills of attention and observation, analysis and interpretation, curiosity, compassion, communication, perspective taking, self-reflection, emotional resilience, and tolerance of ambiguity and uncertainty. These essential skills are arguably better tutored through active participatory learning than through didactic instruction, and better rehearsed in settings and practices analogous to clinical situations, rather than in actual patient encounters. We can add to narrative and visual art analysis a third arts-based strategy, theater. Drama, too, offers methods and materials for active learning that is probing, creative, collaborative, and reflective. And of course, as any veteran clinician will attest, a doctor's life, a doctor's learning are rife with stories. And even on ordinary days in the clinic or on the wards, there's drama to live out and learn from. 30 years ago, medical historian Todd Savitt at the medical school at East Carolina University created a Readers Theater program in which short stories about medicine were adapted as theatrical scripts. Medical students from East Carolina performed a story by reading it aloud, and then the actors and their audience, often a community group like the Rotary Club or something like that, would together discuss the drama and the ethical and social issues it raised. These plays and the post-performance discussions, and they go together as a package, enlivened and changed how these future physicians and their audiences, prospective patients all, approached and learned from one another. The best way to learn about Readers Theater? Just do it. In this Medical Center Hour, we have 4 UVA medical student actors who will present a dramatic reading of physician-poet William Carlos Williams' 1938 short story, A Face of Stone. Following the performance, you, the audience, will join us. Collectively, you'll be our 5th player, and together we'll respond to the play and the ethical, social, and cultural concerns it brings to life. To map out this program, we'll begin with the play, A Face of Stone, which will take just a fraction of the hour, and will then follow with moderated discussion. I have some questions, but you too will have questions, observations, and interpretations, and all are welcome. Everyone, including the actors, is encouraged to join in. I'd like to thank the Medical Humanities Interest Group, the Sloan Society, and its chair, second-year medical student John Costello, for helping us to organize this program. I'll let you know who our 4 actors are. On my far right is John Tomkinson, who is taking the role, the voice of the narrator. Allee DeFelice, who is the woman. Zev Gurman, the man. And Gregory Streeter, the doctor. And now, A Face of Stone.
The story you are about to hear takes place between World War I and World War II. As they entered his office, the doctor glanced at the clock on his wall and heaved a heavy sigh of frustration. A hurried lunch again, he thought. He motioned them to sit and noticed that, as they did so, the man made no attempt to help his wife with her chair.
What is it?
He asked, looking at the child asleep in the woman's arms.
It's the baby.
The doctor looked at the man, Ah, he thought, one of those fresh Jewish types, the presuming poor whose faces change the minute cash is mentioned, who take advantage of kindness at the first opportunity.
My brother told us to bring the baby to you. We already had a doctor, but he was no good.
Of course.
No good. How do you know he was no good? How long did you see him?
Were you paying him?
It doesn't matter. What did you want to see me about?
I want you to fix the baby, Doc. My brother says you're the best baby doctor around here, and this kid's sick.
Well, put it on the table and take its clothes off.
Neither the man nor his wife moved.
Put the baby on the table and take its clothes off.
Still, the woman wouldn't move. She sat there, staring at the doctor, holding the baby tightly to her chest. Immigrant, he thought. Italian, probably. She looked dirty, like her husband, her hands and face grimy, nails as black as her hair.
If you want me to examine the baby, you'll have to put it on the table.
Give me the baby.
The woman continued to stare at the doctor with no expression at all on her face. A face of stone. Animal distrust, the doctor thought. She's like an animal that senses danger and is on guard against it.
Give me the baby.
No, I hold her.
And the doctor knew, from her accent and grammar, that she had not been in this country long.
Give me the baby. He wants to examine it.
Listen, do you want me to examine the baby or not? If you don't, I really have...
Wait a minute, Doc. Wait a minute.
You look at the throat.
All right. Put the baby on the table and remove its clothing.
But the woman still wouldn't move. After a moment, the doctor started twirling a pencil through the finger of his left hand. He turned to the husband.
Never mind. What's wrong with it?
She's getting thin, Doc. What do you think's the matter with her?
What do you mean thin?
Then,
The doctor turned to the woman. She flinched, but didn't move.
How old is she?
4 months, 1/2,
I see. And how much does she weigh?
13 pounds, 1/2.
13 and a half pounds, Doc.
That's really not that bad. Have you been feeding her?
My wife is nursing her.
I nurse.
I see. How often do you nurse? When do you nurse her?
When she hungry.
And how often is that? How often is that?
She probably don't know, Doc.
What kind of labor did she have?
I don't know. Regular, I guess.
Was this her first baby?
Oh yeah, this is her first.
The doctor made a few notes on the new folder in front of him, and then stood, walked around his desk, and leaned against it, facing the woman.
Is the baby ever sick? Does it ever have a fever? Does it ever throw up?
Sometimes she throw up.
How often? How often?
Every once in a while.
My milk no good?
Not necessarily. Let me see the baby.
The doctor leaned forward, reaching for the baby. He took one look at him and let out a wild scream. The woman clutched the child to her breast, stood and turned for the door.
Baby scared. We go now.
Oh, Christ.
Don't be so scared. He ain't gonna hurt you. I'm sorry, Doc, but she ain't been in this country long and she's afraid you're gonna hurt the baby.
The man turned and went to his wife.
Give me the baby.
He took the child from her arms and carried it to the table, removed its clothing, and stepped back to give the doctor room to examine it.
You look at the baby, Doc. I'll keep the wife out of your way.
The doctor looked at the still screaming infant and could find nothing wrong with it, other than the natural results of foolish, irregular routine and probably insufficient breast milk. He handed the child and its clothing to its mother, who huddled by the door and dressed it.
There's nothing wrong with the baby, but she does need to be fed on a regular schedule. You explain that to your wife.
You got it, Doc.
And the baby will need some formula to supplement the mother's milk. Get some, and see to it that the baby gets it on a regular schedule.
Okay, Doc.
We go.
Yeah, we go. Thanks, Doc. You're a good guy.
The man reached into his pocket and pulled out a small wad of crumpled bills.
How much we owe you, Doc?
$3.
Oi, Doc. I'm a working man. I can't afford...
Please, we go.
Okay. Look, Doc, I want to be fair because you've done right by us, for sure. But I really can't handle more than a couple of bucks.
That will be fine. Now, look, I'm very busy.
Sure. Sure, Doc. Here you go.
The man laid the money neatly on the doctor's desk, turned, and joined his wife at the door.
By the way, Doc, if we need you any time, I want you to come out to the house and see it. You gotta watch this kid.
Ah, the doctor thought. But of course.
I don't know. Where do you live?
1317 Marsh, out in West End, near the old warehouse district.
Near the dumps, the doctor thought.
I'll come out if you give me decent warning. Call me in the morning, and don't call me out there every time the kid gets a bellyache, or because your wife thinks it's dying, or at dinner time, or at 2 in the morning, or in the middle of a snowstorm. I'm telling you now so you'll know. I've got more than enough to do already.
Okay, Doc. But you come.
Only under those conditions.
We go now.
Yeah. It's a deal, Doc. Bye now.
Goodbye.
And the man and his wife and their child turned and left. And sure enough, on a Sunday night at 9 o'clock, with the thermometer at 6 below and the roads like long black skating rinks, they called the doctor at his home.
Nothing doing.
But Doc, you said you'd come.
I am not coming out there tonight. I won't do it. I'll ask my associate to make the call, or maybe some good younger man who lives in the neighborhood. But I am not coming over there tonight.
But we need you, Doc. The baby's very sick.
I can't help it. I'm not coming.
Who in the world are you talking to like that? His wife asked. You mustn't do that.
Leave me alone. I know what I'm doing.
But dear,
I know what I'm doing.
4 months passed. On the first warm day in April, about 20 women came to the doctor's office, all with babies. He started at 1 p.m. and by 3 o'clock was still going strong.
Anybody left out there?
He asked the woman he thought was his last patient. Oh, yes, she said. There's a couple out there with a baby.
Oh, Lord. It's 3:30 and I still have house calls to make.
Hello, Doc.
And there they were, the same fresh Jewish grin, the same face of stone, still holding the baby. But the child had grown to twice its former size. At first, the doctor didn't remember them, but only for a moment.
Hello. What can I do for you?
And make it snappy.
We just want you to look at the baby, Doc.
Oh,
Listen, Doc, we've been waiting out there 2 hours.
Oh, for Christ.
all right. Put it on the table. Come on.
And as the man did so, the doctor noticed a cluster of red pimples near the man's right eyebrow, reaching to the bridge of his nose. Like bed bug bites, he thought. No doubt he would want me to do something about them before they leave.
Well, what's the matter now?
It's the baby, Doc.
I had assumed as much. Well, what's the matter with it? It looks perfectly fine to me.
And it did. About 10 months old with a round, happy face.
Yeah, but her body isn't so good.
You examine all over.
Of course.
Do you realize what time it is?
Shouldn't we take her clothes off?
I suppose.
So the wife began to remove the baby's clothing, and the doctor sat down and started taking notes.
How old is it?
How old is it?
10 months. Next Tuesday, 10 months.
Her expression, no expression, never changing.
Are you still nursing it?
Sure, she won't take bottle.
Do you mean to say that after what I told you last time, you still have not weaned that baby?
What can we do, Doc? We tried, but she just won't let go of the breast. You can't make her take the bottle.
Does she eat?
Yeah, a little, but she won't take much.
Cod liver oil?
She takes it all right, but she spits it back up half an hour later. We stopped giving it to her.
Orange juice?
Oh, sure, most of the time.
Okay, so she's been nursing and eating a little cereal, and that's all.
Yeah, that's about it.
Right. How often does she nurse?
Whenever she wants to. Sometimes every 2 hours, sometimes she just sleeps, like that.
Didn't I tell you to feed her regularly?
We can't do that, Doc. The baby cries, my wife gives it to her.
Patience.
Why don't you put it in the crib?
My wife won't give it up. That's the way she is, Doc. What can I say? She won't do it no different. She wants the baby next to her so she can feel it.
The doctor turned to the woman, still standing at the table.
Have you got it undressed?
You want shoe off?
He stood and went to the table.
Excuse me.
He pulled the child's shoes and socks off together. He picked the baby up by the ankles and back of the neck and carried it to the scales. The woman followed him closely, watching his every move. The baby, apparently much calmer than the mother, merely sagged, smiling in his grasp. He looked down at her clean, happy face and returned her smile, amused in spite of himself.
20 pounds, 4 ounces. What do you want for a 10-month-old? There's nothing wrong with her. Put her clothes back on.
You examine her first.
The doctor's face reddened slightly, but the woman ignored him.
She too thin. Look, her body.
Very well.
The doctor returned the child to the table, fetched his stethoscope, and went rapidly over her chest.
She's fine. No rickets, no problems. Now please, get her dressed. I have a lot yet to do this afternoon.
The woman hesitated.
She all right?
She asked, only with her voice. Her face remained completely expressionless, her eyes a brittle, pale green. The doctor found himself searching his memory for another like it, one he had seen in a painting, perhaps, Mantegna or Botticelli. He shook his head.
Yes, but for God's sakes, get her off the breast. Feed her exactly as I told you to.
No, we'll take bottle.
It's fine. I don't give a damn about the bottle. Just feed her from a cup, from a spoon, any way else, but feed her regularly. That's all.
The doctor turned and went to the sink. While he washed his hands, the woman dressed her baby, clutched it to her chest, and walked to the door. Her husband hovered near the sink and caught the doctor as he turned to go to his desk.
What?
Doc,
He said, too quietly for his wife to hear.
I want you to examine my wife.
What the hell do you think
We
I
waited
am? Do you
2
know-
hours and 10 minutes for you, Doc. Just look her over and see what the matter with her is.
The unmitigated audacity, he thought. But he turned and looked at the woman, still standing at his office door, her baby in her arms. What a creature, he thought. What a face and what a body. He considered the tear in her dress, a triangular rip above the left knee.
Sit.
He gestured for both of them to take seats. The husband did so immediately. The wife, after a long, curious look at both men. What the hell, the doctor thought. No use getting excited with people like these. With anyone, for that matter. All you can do is what you can do. He took a seat at the desk.
Go ahead. What's the matter with her?
She gets pains in her legs, especially at night, and she's got a spot near her right knee. It came last week, a big blue-looking thing.
Has she ever had rheumatism?
The man shrugged.
You know, go to bed with swollen joints, last about 6 weeks.
Both men looked to the wife.
Have you had rheumatism?
She don't know.
The man's face colored slightly. The doctor had noticed it before, but could not remember the exact circumstances. He turned again to the wife.
Tell her to open her dress.
Open your dress.
She did so, slowly and reluctantly, after handing the baby to her husband. She turned and faced the doctor, who came around his desk to where she stood.
Let me see your legs. The left one first.
She untied the white rags just above her knees and let her black stockings fall to her ankles. Her legs were oddly bowed, like Turkish scimitars, flattened and somewhat rotated on themselves.
You had rickets. Late in your childhood.
She didn't answer, just stood there. Her legs, while they did not look weak, were as ugly and misshapen as useful legs could be in a woman so young. The doctor noticed a large discolored area near her left knee.
That spot, it comes from a broken varicose vein.
Yeah, I thought so. She's got them all up both legs.
It's from carrying a child.
Oh, no. She had them before that. They've been that way since I've known her. Is that what makes her legs hurt?
I don't think so.
The doctor took each of the woman's legs in his hands and looked at them carefully.
No, I don't think so.
What is it then? It hurts her real bad, especially at night.
Well, in the first place, she's bow-legged as hell. That throws the strain where it doesn't belong. And look at those shoes.
Yeah, I know.
She was wearing a pair of fancy high-heeled slippers, evening wear. They were worn and badly broken down.
I don't see how she can walk in.
That's what I told her. I wanted her to get a pair of shoes that fit, but she wouldn't do it.
Well, she's got to do it.
He turned to her.
Throw away these shoes. Get shoes with flat heels. Cuban heels if you must, but new shoes. How old is she?
Her husband again reddened slightly.
24,
And where was she born?
in Poland.
Poland. Are you sure?
Yeah? Why?
Well, 24 years old, you say? That's different. That's probably the explanation for her legs. She must have been a little girl during the war, maybe 5 or 6 years old.
He turned to the woman.
Is that right?
She didn't answer, or wouldn't, or couldn't.
What did you get to eat?
If she heard him, she gave no sign. She turned to her husband.
Did she lose anyone during the war?
Everyone. She lost everybody.
How did she get over here then?
She came over 4 years ago. She has a sister here.
So, that's it, the doctor thought. Watching her take her baby from her husband's arm, watching her fussing with it, cooing at it, paying no attention whatsoever to anyone else in the room. No wonder she's built the way she is. What she went through over there.
What are we going to do about her pain, Doc?
Get her some decent shoes. Do that just right away.
Okay, Doc.
She could be operated on for those veins, but I wouldn't advise it. Not yet, anyway. Get one of those woven elastic bandages, a 3-inch one. They're inexpensive and they'll help.
Doc, can't you give her some pills to stop the pain?
No, not me. But I think you should get her teeth looked at, maybe, if you want to, that kind of thing. And damn, okay, I'll give you something, but it's not dope. You understand? It's only going to help if there's some rheumatism connected with that pain.
The doctor turned to the woman and waved to get her attention.
Can you swallow a pill?
How big?
She swallows an aspirin when I give it to her, but she usually puts it in a spoonful of water first to dissolve it.
Once again, the man reddened, and the doctor saw, for the first time, the nature of the love he felt for his wife and the extent of her reliance on him.
They're pretty big pills. Look, they're green. That's a coating that keeps them from upsetting your stomach.
Let me see.
She held out her hand to the doctor, and he placed a few of the pills in her palm.
For pains in leg.
Yes.
She looked at the pills in her hand for a moment, then back at the doctor, and for the first time since she had entered his office, several months passed, she smiled.
Yes, I take them.
So there we have a face of stone. And now we'll turn to you to join us in discussion with the actors about the play and what we learned, what you noticed, what it set you to thinking. We have a couple of mics. John Costello and John Gwynn will bring you, one of them will bring you a mic. It's not to make you a star, it's simply to ensure that your voice is heard on our recording. So first, I'll just invite you, offer your first impressions of what we've just seen. What stood out to you? How did it feel to enter this drama so nicely done by these students? First impressions. There are, in this discussion, by the way, no right or wrong answers.
Hello. That felt very paternalistic. There was a lot of just the doctor top-downing the patients and not really listening to them or taking any time to really understand what was going on. So that was something I noticed right off the bat.
Let's kind of take note of that. Here's some other impressions, and we may well come back to that in terms of the doctor's demeanor.
Hey. I really felt for the husband. I felt like he was really having to act like the mediator between the wife and the doctor, and it was tough for him to like have their communication clear. Felt like a lot of hyperbole around prejudice, the Jewish assumptions and immigrant assumptions that the doctor so obviously stated in his thoughts, but luckily not out loud.
It was nice to have that narrator as the doctor's inner voice and sometimes his conscience. What stood out to you?
I guess this is just representing change of the times, but it really stood out to me that the man still thanked the doctor after their first visit, even though it wasn't is not the best bedside manner.
I'll ask the actors. How did that exchange feel? There was a bit of a dispute about the money, but also there was that, hey, we want to come back.
Yeah, I mean, the man kind of gains a spine. Like he's initially very supplicant.
Mm-hmm.
Well, I did a wonderful job, so I correctly assessed that your baby was healthy and it deserves every dollar that you gave me. So, I think, like, as an actual human today, I thought was interesting about that was there's $3 was the agreed upon amount, or the I guess billed amount, if you will, and you were only able to produce like $2, and it that dollar difference seemed to make a big difference to you, but it made so little difference to the doctor. He just wanted you out and to be done with you, and I just thought that was a sign of how dismissive the doctor was at the time.
Or how altruistic and unconcerned with money.
Yeah, that's one interpretation.
Yeah. Mm-hmm. I think one thing that hasn't changed is the busyness of clinics.
Mm-hmm. Mm-hmm. Yes.
First, I just want to say you all did a great job knowing Williams's other doctor stories. It really brought to life the feel that I get from his different characters and these dynamics, and it was super uncomfortable the first bit. What struck me was that the moment of transition for the doctor into sympathy, which had to do with actually seeing something, actually seeing a deformity, and then imagining the narrative there. So that's what jumped out at me.
So you found a turning point in the story. Let's come back to that. Let's look a little at one of the first things that came up, and that was the doctor's demeanor, which has been characterized as more paternalistic, perhaps, than we're comfortable seeing today. But what do you make of the way the doctor presents himself? And we have, thanks to the narrator, the doctor's unfiltered thoughts as well, in which he discloses quite a bit more about what he's thinking of these people, about this demand on his time, about the kinds of requests they're making. Is this any way to treat patients? How do you explain the doctor's persona in the exam room?
Hello. I just wanted to say that you guys did a great job, but I felt that the doctor was just really dismissive, and since he is kind of in like the place of power, he kind of just seemed to assume that he knew exactly what was going on instead of asking more and trying to look at like the bigger picture, because they kept coming back and he kept saying the baby's fine, but there's obviously like a reason why they kept coming back that should have like clued him into it. And I feel like it just took him a while to finally like ask more questions.
Mm-hmm. Mm-hmm. So one aspect of his persona is his busyness, right? And we know from what the narrator says, he's also pretty preoccupied with his time, which is obviously, and to him as well as to anybody else perhaps in his office, quite precious. People pay for his time. They don't get very much of it. And even though the story is 80 years old, this emphasis on time is one that may feel familiar. So how does the doctor's attitude about time work for him, or how might it work against him?
My comment didn't really have
okay.
to do with that
That's
particular question, which is a great question. But I thought it was interesting that the person who's not sitting in front of us, his wife, also called him, on his behavior, and he brushed her off and was dismissive of her in the same way that he was of his patients.
And you're referring to the conversation in the
When he
doctor's
was
household when his wife
Exactly,
says,
when he was on the phone.
"Who are you talking
Right,
to?"
you shouldn't be talking to them like that.
Yeah. Yeah.
Seems like his desire to stay on a regular schedule, to have the baby eat on a schedule, sleep in a crib, also kind of mirrors how he wants to have his practice. Don't call me at this time in this weather at home, blah, blah, blah. But that fails to take into account the messiness of the humans that he's actually dealing with. But once you stop hearing the narrator telling his prejudice toward the end when he's now in his own human space, which I thought was really interesting too.
Good observation.
There's a great little piece of line in here that I think is really easy to not hear, but I think a narrator says this. It's like the doctor. There's like 20 women, all with babies. The doctor starts at 1 p.m. and was still going strong at 3 p.m. So I'm trying to imagine seeing 20 patients with babies in 2 hours, and that being the norm. And I'm not good at mathing, but that seems like not a lot of time per family. And just I think speaks to how little time was devoted to people back then. So when there were complexities, how do you make time to address those?
And the observation about schedules and regularity of them, whether it's the doctor's calendar or the baby's feeding and sleeping schedules, schedules were heavily emphasized in the 30s, 40s, 50s. It was part of, our industrialized assembly line society that, this kind of order was a good thing. And the doctor is again, pretty miffed when he finds out 6 months later that they haven't followed his advice about the feeding schedule, the sleeping, and other things, and immediately calls them out for that. But it also stems perhaps from his own frustration of the efforts he's making to try to keep to what sounds like a pretty difficult schedule.
This is a little unrelated, but just as a comment on a comment made back here, it's interesting that the first time we see kind of like a sympathy from the doctor was when he saw something, like something visual. So it'd be interesting to see how he would handle like a mental health conflict or something that he can't visibly see or hear or, identify right off the bat. Like at what point, obviously mental health was not really recognized in the 40s and 50s and 30s, but nowadays it is. And that's just interesting.
It's a good observation. It may point to some of the continuing challenges of the mental health dimensions of care.
To the question of how his focus on time might have been helpful, I kept waiting for him to have missed something huge. I mean, of course, he is kind of missing the mother and her whole story. But as far, I kept expecting, a tragic misdiagnosis or, because he was, rushing through. But actually, to his favor, seeing those 20 patients and that time management seemed to have helped him have a kind of laser focus on spotting the things that he was willing to look for and see. Do you know what I mean? So, if he had these long, discursive and wandering kind of visits with everyone, then he wouldn't have been able to see as many patients. So, it's a tension there. So it seems like actually, he had quite a bit of expertise.
And he never would have gotten to his house calls, which he does late afternoons and evenings. Yeah.
Thank you all. Kind of to your point about the mental health and also the point of missing the mother. Just those few parts, especially at the beginning where we hear of her flinching and just her stone face and different things that I think nowadays doctors are trained more and more to be looking for those in new mothers and to be looking for signs of mental health problems or safety issues or just like past traumas or anything like that. And in this case, it seemed to just, especially at the beginning, be something that he may have noticed but didn't take into account.
Good point. So those visual attention of the doctor to a lot of things becomes very important, and we are a little more tuned into that, we would hope, these days. Yes?
I also think that the time constraint helped the patients, like knowing that he's on a schedule and he's about to go and they don't know when they're going to see them next. I think that kind of, made the husband speak up about his wife, whereas, they could have just been like, oh, okay, we'll come back next time. Like, they know he's on a busy schedule, they know he's about to leave, and like, this is their shot. So like, I think in a way that it helped kind of stress the urgency of, okay, let's just talk about it.
Good. So let's focus on that relationship between, the dynamic between the man and the woman. And there was this excellent observation that the man seems to be in the position of mediating things between the family and the doctor, and even within the family, between the mother and the baby, even. When you think about the three encounters, there was the foiled encounter that only happened on the telephone on the winter night. But in the three encounters, who do you imagine instigated those encounters? How do you think those came about, that this couple came to see or wanted to see the doctor on those occasions? I mean, we don't have any right answer to this, but who do you imagine instigated those encounters and why?
I'll say I think it would probably be the sorry, I'm here. The wife, just because she seems to be the primary caretaker of the baby. And I was also going to comment, kind of going off of what we were talking about before about the time management in their relationship. It seemed like maybe for the doctor it would have been more efficient rather than just like shouting and repeating his demands, to maybe notice that the wife is weary of giving up the baby to him, and maybe just like being more caring and compassionate and explaining what he's going to do the first time would have made it go quicker.
I mean, we may want to digress a little bit and just address the fact, is there some stereotyping going on here? And how might that get in the way and lead to some of the awkwardness and lack of notice that happens? What about the stereotyping? How did that feel?
Felt really uncomfortable. This kind of made you angry, you know, I think, especially from perhaps a current perspective on relationships and what we owe one another. I thought it was, you know, interesting trying to put the story within the time frame in which it happened, and you know, what were common attitudes then, and I was thinking that perhaps even if you know, a physician between the world wars, one would think would be empathetic or feel that that was part of his or her profession. And he treated the wife as if she weren't there. I mean, once he got frustrated with her, then it was, I'm going to talk to your husband. And but to go from that to saying things like, well, she's bow-legged as hell, you know, when she's sitting right there. Mm-hmm. I mean, that's just rude.
So it's a combination of some of the stereotyping and then just of different doctor-patient dynamic, perhaps dating from the 30s. And in other of the doctor stories, Williams has a similarly brusque physician demeanor. And you may have noticed, how did the doctor talk about the baby?
Well, they all called it it.
They all called it it.
He or she or they.
Although toward the end of the story, when the baby's 10 months old and he's actually examining her, they do switch to the pronoun she. But I think the it makes people uncomfortable. Now, I'm going to ask the actors too, how was it to be reading some of those remarks that were clearly the doctors stereotyping these persons?
Well,
yeah, you got to do some of that.
Yep. Well, it was definitely uncomfortable on my end because it was less filtered in that respect. And it's not one of those things that you can kind of just adjust for time and be like, yeah, it was that way back then. It's like, you know, that was wrong back then. They just did it and thought that way. And I mean, the dehumanization of the baby aspect makes a little bit more sense given the high infant mortality rate back in the day. It's almost a protective mechanism to try and separate yourself from something until it starts gaining more of a personality. But it was still pretty uncomfortable, honestly.
I think what's a little uncomfortable and maybe less explicit is sort of the more traditional gender roles that are occurring in the husband-wife dynamic, because the husband also refers to his own baby as it, sort of views the baby as something the mother is in charge of, and he's the mediator between the mother and the doctor, but the baby mother-doctor relationship doesn't really involve the man.
So he is in perhaps something of a more uncomfortable position, having to take charge of the baby when when communication is not happening between his wife and the doctor.
He'd otherwise rather have nothing to do with the baby, potentially.
So again, who probably wanted to make these appointments? Who went ahead and made these appointments? What do you think? Or just think about that and sit with it. Only very late in the story do we learn or discover that, in a sense, the real patient is the woman. Think about what seems to be the matter. We get the doctors through the narrator, we get the description, and also from the doctor that she's remarkably bow-legged as hell, he says, which is a remark that maybe this doctor is also voicing that way because he's surprised. He may be moved by what he has seen, and he may not have a large emotional vocabulary for use in front of patients. So he gets a little more brusque and a little more urgent in terms of how he's going to describe things, and he's going to start being helpful, offering some practical advice and counsel about what perhaps can be done. But we do hear him take in, and it registers with him what's been going on. So what are your thoughts? How would you describe what's going on with this woman, this new mother, with a history?
So I think I find it interesting that it took a process before he offered the pills and the medication, that he was giving practical advice, like buy her new shoes, get her stockings, and then as they were pressing, he finally said, okay, here's the like you can have this medication, but it's not dope. Like the stereotypes continue to kind of subliminally get through. Although they were happy to get that result, I feel like today in this day and age that we don't really have those kind of prejudices as often. I don't know. I think that it's just interesting how long it took before he offered an immediate relief rather than something that would be practical but take longer to result in satisfaction for the patient. And I think just really quick, when they went into the office, the interesting thing was that the doctor had noticed something on the man's eyes, but nothing about the woman. All he noticed is her stone cold expression, and the fact that he thought he was going to ask about himself, but he was selflessly asking about his wife this entire time, which is really cool.
So how would you put into words what's the matter with this woman? Or what's going on with this woman? John?
PTSD. I mean, she lost her whole family. Of course, she's worried about her child being thin, if she probably dealt with starvation, or God only knows the horrors, and we don't know what age she was when she was enduring the war. But it makes sense that she would be worried about a healthy baby being thin when she probably doesn't even know what normal childhood looks like from the little we know of her history.
Good point. And the malnutrition, the vitamin D deficiency may also have resulted from never being out in sunlight as a child in the war. So I think there are some things she doesn't have anything to measure with. What does the baby mean to her? What do babies mean to us? John?
Something to live beyond ourselves, hope, continuation of life.
And we see she's quite an attentive mother. She's the one who keeps the very careful calendar of how old the baby is, even down to the day of the week. It turns 10 months old. That kind of attention, there's no faulting of the mother in those terms of mothering. There is faulting because of the inattention the family seems to show to schedule, a rigid schedule of feeding and sleeping, which may tell us more about the 1930s than it does about the mother-baby bond. She's also in close physical contact with the baby a good deal of the time in this encounter. The other thing she's close to in the encounter is the door of the exam room. This is not a comfortable place. So, when you think that over 3 visits, over a period of 6 months, it takes before there is this exchange, a really open exchange between the doctor and the mother. What do you make of that? And someone very early on alluded to the sort of turning point in this story when the doctor sees something that falls clearly within his domain of expertise. How do things change, and what begins the process heading toward the resolution we know of this story, which is simply the doctor gives the woman the pills, which are going to be for the pain in her legs, and in return, she agrees to take them. She never agreed to take any of the other advice, but she agrees to take them, and she smiles. What does that smile mean? And you actors can say this too, since Allie had to sit here with a glaring expression and a mistrustful expression a good deal of the time.
Thanks. Is it on? I think it means that she's thankful in a different way than they've been thankful up to this point. But I think someone's finally listening and noticing. And even her husband noticed but didn't know what to do about it. And it took until this point, their relationship with the physician, for even him to speak up and ask, "Can you look at my wife?" So I think it goes back to the idea of hope.
Does the doctor or the man have any insights on that?
Yeah, I mean, she is not a very trusting person at all, and I think there's a huge element of a change in trust between her and the doctor. She's lost all of her family. Everybody's done wrong to her entire life. She's in a new foreign country. She's only been here 4 years, and she doesn't want to give up the baby because she doesn't even trust the doctor to touch the baby properly.
And I think too that moment comes after this pretty, I would imagine, moment of a really powerful vulnerability for you too, because you hand the baby over to the man, and then you have to sort of open your dress and remove your stockings, and it's a lot of things. I think even today, modern day, you're still a little bit like, hey, what's going on there? And so I think like that, I just imagine that'd be a really vulnerable position, like as for someone in your shoes, in your character's shoes. And it's interesting to me that like that moment of like thankfulness comes after that like really like intimate exam.
So there were some comments at the very beginning about the doctor's paternalism and his sometimes not so friendly demeanor. Does your estimation of the doctor change over the course of the story? And how? Is he still a hopeless paternalist at the end?
I want to say yes, I do, but at the same time, I don't know if he's entirely there yet. Like, he does express to a degree, like a certain tiny degree of sympathy when he realizes that, you know, this woman has come from somewhere that's really traumatic and she has a lot more going on than just, you know, the past history of rickets or the veins. But he, even in his assessment, you know, like, he's not kind in saying things like she's bow-legged as hell, and he's not kind in delivering that kind of, you know, diagnosis, and he's still withholding the pills until the last minute and still passing the stereotype. So I don't really grow that much fonder of him towards the end of the play.
Do you think this, working with this family, we've noticed a change in his attitude, in his tone of voice with the family, with the woman? Do you think he's changed, and do you think this is a change beyond this moment, beyond this encounter? Has he learned anything? And if so, what?
I think just to throw the title of the movie in there, Face of Stone.
Mm-hmm.
The Face of Stone, I think, is meant to explicitly refer to the wife, but the doctor initially has a face of stone as well. And I think we do see him soften a little bit, but I think actions speak louder than words, and time would tell whether or not his behavior or his thought has actually changed. I think this might be an initial event for him, but it doesn't demonstrate any sort of palpable change until we know more.
Mm-hmm. Good. Yeah, and I think that title, you know, is used there to pique our interest, ask us to wonder.
I think maybe looking back on it, we might wonder whether he's burned out, or he's got compassion fatigue, or, you know, because he's frustrated by everything, and he doesn't seem curious. Mm-hmm. He seems to have lost his empathy, and those are, you know, he's exhibiting all of the signs that one would see of somebody who's needs a break.
So actually, one of the things you're noticing is that in the course of this story, your estimation of him has changed because you are now sympathetic to this person as showing signs of incipient burnout, and someone whose working conditions may not be the best if he's expected to be offering the kind of compassionate, in-depth, continuous care that he's in the position to give here. One last sort of trivia question. There was mention again and again of the fact that she needs good shoes, sensible shoes. Because as the narrator has noted, she's come in wearing some broken down, formal evening slippers. And I'll just let you muse on that. To what extent might those shoes, a seemingly, you know, trivial detail, but what might those shoes signal to an observant physician about why someone in pain would continue to wear and walk in those? We don't know whether she was wearing them on the first encounter or not, but she certainly is 6 months later. And with that, as you think about the shoes and walking in other people's shoes, I'd like to thank the actors, the narrator, all of you for being here and participating in this discussion. And Mary Faith's comment was a brilliant lead-in to next week's Medical Center Hour, which will double as Department of Medicine Grand Rounds. It's a program called Time to Talk About Burnout. And we will be welcoming Dean Giannakis from Centra Health in Lynchburg, Virginia, to talk with us about burnout, focused particularly on clinical trainees, which would be, you know, the clinical level medical students and residents, but also everybody who's trying to keep to a schedule such as Ori previewed for us with this doctor 20 patients in 2 hours. So thank you all for spending this hour with us. Thanks again to the actors, and have a good afternoon.